Okay.
Dr. Jones, back with Dr. Jones in Orange County. Dr. Jones, put some light on an issue here. When us people have a missing tooth, and I'm talking about a missing tooth or 2 or 3 in the back, because in the front, even when we are small or big, it doesn't matter. We go to a dentist rather fast because it just simply looks ugly. But in the back, not so much. Some of us have a missing or 2 teeth for a long time. And it doesn't look like anything bad is happening. And yet, dentists all over the world keep telling us you got to replace those missing teeth. I look at it a little bit as a controversy, as a contradiction. Like, wait a minute, who are you to tell me that it's so bad? I don't see anything bad. Shed some light on it if you can.
Well, Helmut, one of the things is that we are very fortunate as human beings in that things that may be happening to us in a negative way don't necessarily happen rapidly. And so we do sometimes have some time to make the right decision. However, the negative effects of missing teeth, missing back teeth especially, do carry on and continue to get worse and worse and worse as the years or the months and the years roll by. But the main part of that is our back teeth function as the grinding, the main chewing teeth in our mouth. And if we lose back teeth and lose that function, we are now forced to have our front teeth that aren't made to grind down food. We're forcing them to handle that function, and they just can't. So our front teeth will start to wear out. They'll start to chip and fracture, and I've seen many people who have missing their back teeth, and over the years their front teeth start to wear down, and by the time they come to me, it would have been just much better had we started it earlier. We still can help people where their front teeth are starting to grind down, but yes, it is a major factor that when back teeth are lost, other teeth have to take over. And the fact is the teeth that are taking over aren't designed to handle the kinds of forces that we're putting on them. So removing or having teeth lost, back teeth especially, is not a good thing to leave that space for a long time.
Got it. Now I've heard, and I come from a mechanical background like machinery, and I can think with cogwheels, having a tooth missing, and the machine may run a little while still, but eventually it comes to a screeching halt. Hinges being out of line. Now, so I've heard that, so when you eat, basically not completely designed, almost like if you have a bunion on your leg, on your foot, and you start walking funny, or just you have a rock in your stone or something like that, anyway, a blister, you start walking funny, and if you do that, eventually your knee will hurt, eventually your hip might hurt, and all kinds of things. And I've heard that yes, the hinge here, which keeps the mouth flapping, is the most complicated hinge in the body. And it gets out of alignment when you do what you just said with funny eating. Is there some truth to that?
Absolutely, there's truth. You're right. The hinge that helps the lower jaw and the upper jaw masticate food to move up and down is the only joint in our body that actually translates and actually moves out of its hinge socket so that we can chew food and grind food. It is the most complicated. And when we're missing back teeth, other teeth start to shift into that space. And that shifting causes our joint space to shift as well. And when that starts to shift, not that it happens to everybody, but the possibility of derangement, of pain, of joint issues, of jaws staying open and not being able to close, or jaws that are closed and you can't open them, all of these issues are very real. And I've seen them all. Every single one of these issues that we're talking about, I have had patients that for one reason or another have had jaw joint issues. And that's one area that I have taken a 3-year postgraduate training in, and I do specialize in, and I help people all the time with issues in their jaw joint, that it is so painful. And to them, it doesn't seem like there should be anything wrong, because maybe a month earlier, there was nothing wrong, and they haven't done anything differently. But all of a sudden, that pain starts to creep in, And it's all because the teeth have started shifting out of their normal function area and into a place where more stress is being caused in different areas. And this then, again, shifts the stress, shifts the function to places that are not designed for that.
Well, let's talk about this shifting a little bit and this, the pain transferring. Again, from a mechanical viewpoint, the cogwheel which was broken, in that particular area is not necessarily where the machine came to a grind. It may have come to a grind 5, 6, 7, cogwheels down the road or up or down or whatever.
Correct.
And I think in medicine and with a body, let's say we have a headache and we take an aspirin. While the aspirin might get the headache away for a little bit simply because, you can numb a tiger by shooting enough Novocaine up on him, right?
Absolutely.
You can make him like a pussycat. He doesn't feel anything anymore.
Right.
But it doesn't get rid of the thing. So when you say pain and when you say transfers, what are we talking here? Are we talking headaches, neck pain, shoulder pains? Are we talking this type of things? And the course you can, is that a TMJ
Absolutely.
course? Is that what you talked about, a TMJ?
Yes,
treatment?
yes. Well, TMJ is just a synonym for the jaw joint itself. It's the temporomandibular joint, and this is the whole joint apparatus. And if you realize that the nerves that come out of our skull all transfer down through this area, through our neck, and it can be a neck pain, it can be a back pain, it can be a head pain, it can be a toothache pain. There's just a variety of pains that can be associated with the TMJ. It is a big box that a lot of people have put different kinds of pain into. And it's my job as a dentist to rule out the fact that it's the teeth that are the cause of the pain that you're having. Years ago, some really, really intelligent physicians and dentists got together and they studied people that had these kinds of pain. And a neurologist would say, well, it must be this problem. And an ear, nose, and throat doctor said, no, it must be this problem. And a dentist said, no, it must be this problem. But in reality, it was the same patient. He didn't have 3 problems. There was only one problem. And my role as a dentist is to rule out the fact that it's the teeth causing the problem. And I'll tell you, Helmut, most of the time when people have teeth misalignment and pain, whether it's from missing teeth or any other problem, most of the time, the pain they're having, whether it's neck pain, back pain, head pain, eye pain, ear pain, any kind of tooth pain, is coming from the jaw joint, the TMJ itself. And if we correct or balance the fit of those teeth and put that jaw joint back to an restful, mostly functioning position the way it was designed to function along with the teeth, that pain just melts away. And these people, I can think of dozens of people that I've helped in this area that they're just so grateful that I had the training, and it wasn't anything special about me necessarily, but it's just that I had the training I was able to help them.
Right.
And they were so grateful.
Right.
So
what you're saying here, Dr. Chance, is, what I hear you saying is that if a person runs around and having headache, neck pain, shoulder pain, wakes up in the morning all stiff and whatever, and he has tried certain things, tried a chiropractor, done their fair amount of Advil and all that, and it kind of keeps creeping back in. Would it be wise for him, especially if he has missing teeth, but even if not, because, teeth can be growing not correctly in the first place, you could have a wish flash and the whole thing gets out of whack. There are many things, you know what I mean?
Absolutely. Absolutely.
So, but at least if he has missing teeth, either way, if he has headache, back pains, and if other medical specialists kind of not really getting to the root of it, would it be wise for that guy to go to a dentist and say, are you good at TMJ? And if the doctor says yes,
absolutely,
sit down and say, give me an examination. Would that be a good thing to do for them?
Absolutely, because the one thing that's nice about that, Helmut, is that we can diagnose the problem without ever altering a tooth. We don't have to put a filling in or grind on a tooth or do anything. We can make sure that the teeth either are the problem or maybe they're not the problem. But we can do that without even touching the teeth at all. And that's the beautiful thing about diagnosing that. And once the pain goes away, the patient is so anxious to have their teeth balanced so that the pain will stay away and will not come back. And whether that means replacing a tooth that's missing or slightly adjusting teeth that are already there, whatever that is, the diagnosis is made way before any of that is even started. So we are able to help patients get them quickly out of pain and then diagnose a dental solution so that the pain will stay away.
Well, apparently, as I've mentioned before, whoever made us, let's call him God. You know, he put a lots of important things in this little tiny thing. You know, the eyes, the brain, the nose, the ear. So what would make us thinking that the mouth is any less important? Because he did put it into that cluster of good stuff. Not that the leg and the heart isn't important and the kidney, but with no doubt, like probably most other organs, the teeth, people don't realize, I at least haven't realized for a long time, and by talking to somebody like you, I start realizing that, oh my God, these little tiny teeth, this isn't only about looking like Tom Cruise and Julia Robertson. This is about a lot more.
But Helmut, realize what happens with the mouth. With the mouth, we nourish ourselves. Our whole body starts with everything that goes through our mouth. With our mouth, we express love and concern to our loved ones. And we use words that are loving, and we express our feelings. And if we're disgusted with somebody, we express feelings that might not be so loving. All of that happens with this little space called our mouth. And it's so vital to our entire soul, our entire being. Because all of that is generated and happens right in our mouth. No wonder it's so important.
Correct. And like, let's say you get a little headache or shoulder, neck pain, whatever it might be, from a missing tooth or from just a misaligned tooth, whichever way it came. I mean, just imagine how life, all of a sudden, you become grouchy. You're not as loving anymore with your spouse. You're not as loving with your kids. You don't want to go to the zoo because you go, well, not today, I don't feel like. And how can work possibly go well if you have too much of that? Do you know what I mean?
Absolutely.
Thank you very much for your candidness. This was very informative, Dr. Jones. Bye-bye.
Bye now. Thank you, Helmut.